Hello and welcome back to APTA Next here in Chicago, Illinois. My name is Kyle Stapleton, the Director of Communications of the APTA Student Assembly Board of Directors. We have a good one today. We're here with Dwayne Scotty and Jane Meyerson. They're orthopedic manual therapists from the state of Connecticut, which is where I'm from. Thank you so much for joining us, guys.
Thank you for having us, Kyle.
Awesome. So we're talking a little bit about their educational session that they had yesterday on one size does not fit all for manual therapy. So why is it important that manual therapy is not performed with a one-size-fit-all mindset?
Well, I think whenever you're learning any manual therapy technique, it is important to kind of standardize and do a one-size-fits-all approach in order to really get the technique down from a learning standpoint, learning those psychomotor skills, so you can kind of standardize it, and that's what we do in school, right? So to make sure that therapists are proficient. However, when you go in the clinic, not every patient is the same size, right? So you're going to need to kind of add that art of physical therapy, if you will, to adjust some of those manual therapy techniques.
So I know you talked about that not all patients are the same size, but not all therapists have the same strength. So a lot of these techniques require a lot of energy expenditure and different hand grips as well as awkward postures. But in addition to that,
some of it really, you could probably utilize some tools, right? If therapists didn't have the specific strength.
Yeah, especially like if their hands are bothering them, using instrument assist or anything else could help change techniques or soft tissue that you were doing on them.
Absolutely. And so how does manual therapy kind of fit into a multimodal approach for patient care?
So manual therapy in general is not for every patient. Not every patient needs it or requires it. But when you do have that patient that you think a manual therapy technique would be appropriate, the big things you want to make sure is that you match their expectation and they're buying into what you're doing. But again, this manual therapy that we do, the effects are not long lasting. They're short. Right. And they provide this window of opportunity for your patient to feel better, which allows them to move easier, so that we could show them these corrective exercises or stretches or self-mobilization so that they could learn how to treat themselves or manage their own care to help accomplish their goals.
Absolutely, I love that. One big thing is that research is always evolving. There's always plenty of research coming out about manual therapy, a lot of recent research. So how do we use research in making our clinical decision-making in regards to manual therapy?
Yeah, so we know research is important. What I like to think about is really utilizing the best available evidence out there to really inform your practice when it comes to manual therapy rather than dictate it. Right, so you're not going to take one research study that was done on a particular technique and ultimately apply that to all of your patients with that condition. So if you think about like some studies that look at, let's take mechanical low back pain, for example, was that research study and that specific manipulation technique that was it performed on all patients with mechanical low back pain, or was it for patients that had pain with flexion or patients that had pain with extension? So really kind of looking into the methods, and honestly one of the limitations or the balancing act that we have is really looking at some of the studies that we classify as being high rigor in the scientific journal world of having these, kind of controlled environments, high internal validity. The drawback to that is, again, when we apply these manual therapy techniques, we're doing it more from a pragmatic standpoint. So we're really looking at more of that like external validity, and is it generalizable to the patient in front of me? So we want to utilize that research, but utilize it to inform your practice of the patient that you have in front of you. And then lastly, think about some manual therapy techniques we don't have evidence for, but we don't know what we don't know. So just because we do not have specific study that shows this technique works with this population, it doesn't necessarily mean that you can't implement it into your practice. We just maybe haven't designed the study yet.
Absolutely. One thing, as a student, I'm always trying to refine my manual therapy skills. And I think it also goes for the new professionals and entry-level clinicians. So how do we continually refine and improve our manual therapy skills?
So with that, practice, that's the main word, but practice doesn't make perfect, practice makes permanent. So the idea is that keep trying your skills, keep practicing with different colleagues, but also what you should really do is practice with your family, your friends, and different age ranges too. When grandma and grandpa or mom and dad come home, practicing on them so you can feel different qualities of tissue and joints.
Much different body types, right?
Yeah, no, absolutely. And I think Jay hit it right in the head there with the word practice. So I think of it as like 3 Ps, like practice, practice and practice. So not only like practicing the psychomotor skills, so you have to do that, get your reps in basically, but also think about practicing your pattern recognition, right? So kind of picking up on those patterns. Is this a shoulder pain with a mobility problem, or is it shoulder pain with a muscle power problem, right? So kind of being able to classify your patients, you need to practice that skill, and then you need to practice actually implementing those specific manual therapy techniques with those specific patients that require it.
Right.
So it's really kind of all three of those, I think, is going to be really beneficial for new grads out there, new professionals, or students that are starting to integrate the manual therapy. And then lastly, what I really think is important is to not give up too soon. So I know for me as a young clinician, I learned all these great manual therapy techniques in my educational process, and I went out there, I started doing all of them, and then I was like, some of these aren't really working, so I abandoned them. But I think the pattern recognition stuff, we weren't doing that when I was a student.
Right.
So you guys now coming out, being younger clinicians, are getting that in your educational process, which is so important. So before you abandon something, make sure you kind of reflect on that process and think about, hey, how is my technique, number one? Am I just not clean in my technique? Do I need to improve that? Or did I really utilize the technique for it wasn't the right patient that I was utilizing it for? Before you say, oh, this technique doesn't work.
And I think that also goes into using CPGs and CPRs for that pattern recognition. So I think that's another way you can enhance your manual therapy techniques and in getting that pattern recognition. But I think kind of bridging off of that, how do students maximize their clinical experience using manual therapy?
So with that, it's a couple different aspects. My role is I'm adjunct faculty at a university, but also I'm a CI, so I take numerous students, and I'm also a mentor to residents and fellows. So I think the message goes along the whole continuum of basically, the first thing is ask questions. The people that are your mentors, they're not gurus, they don't live upon a mountain in a hierarchy. Ask them tons of questions, and the major question that you want to ask them is why? Why are you doing this? What is your clinical reasoning behind it? And not in a way that you're challenging or you think that it's not correct, but you want to think about how their brain thinks, because that will help you develop your clinical pattern and reasoning a lot faster as well too. And the other thing that I hope CIs are doing, I know I do this, and I'm sure Dwayne does this when he's in the clinic, is have your students, have residents, have your fellows, have them practice on you. The reason being is students, they're in class practicing on each other, and they don't really know exactly how things should feel, pressure, what's right, what's wrong. So it's a tough challenge, but after they practice on you, you could actually give them one-on-one external feedback of, hey, you're a little too tough with this technique, you're a little too soft with this one, move your hand here, use your body type there. And I think that's the best way for learning to occur from that way as well too.
And I really think that in terms of giving students advice is, when you go into a clinical setting, try not to just kind of adapt to that specific environment and treat just like that CI treats. Right. Take the information that you learned in school, apply that, take the information that you're learning on site from your CI, and then use that. And then most importantly, spend time with your patients. So you need to spend time with your patients, you need to talk to your patients, you need to learn from your patients, you need to ask the right questions, and spending that contact time with your patients, as opposed to thinking getting things done quickly or delegating too much too soon, I don't think you can really utilize your clinical reasoning and then reflect back on what worked, what didn't work, unless you're spending your time with your patients.
Right. Awesome, magnificent. Dwayne and Jay, thank you so much for joining us here.
Thanks for having us.
Thanks for having us.
Awesome. And we'll be back with some more interviews here at APTA next.